My name is Rashmi Halkar Singh, and I'm the Deputy Editor of Headache. It is my pleasure to be speaking today with Dr. Greg Dussor, who's one of the authors of this year's Basic Science Award. The winning manuscript is Prolactin Signaling Modulates Stress-Induced Behavioral Responses in a Preclinical Mouse Model of Migraine. So, congratulations on this award, and thank you for your work. I'm really excited to speak to you today.
Thank you. Thanks for doing this interview. And I'm excited that this award exists. And I'm thrilled to be, well, I guess now the second recipient of this award. It's really an honor.
Yeah, it's been great to learn more about basic science and how that relates to the work that we do as clinicians as well. So first of all, this manuscript is all about the role of prolactin, and I was wondering if you could share with us what do we know about prolactin and why did you choose to study that as a mouse model of migraine?
Yeah, so it's a good question. You know, we know a lot about prolactin, but we don't know a lot about prolactin in the context of pain and headache disorders. People have studied prolactin, of course, for many, many years, but not in this context. So we've had some NIH funding to work on this for, I don't know, 5 or so years now. So it's a question that we've been asking for a while. And, you know, why focus on it? There's a fair amount of circumstantial evidence that there's a contribution of prolactin to headache. A lot of that comes from conditions where there's a tumor, pituitary tumor, and you get excessive prolactin secretion or prolactinoma. And headaches are a big symptom of that, of those tumors. And when they're treated, when they're pharmacologically treated to suppress prolactin release from the tumor, the headaches get substantially better. So, of course, that's not causative, it's correlative, interesting connection. We know that prolactin levels go up in people around the time of migraine attacks. Also interesting, but correlative, certainly not causative. We know that one of the best ways to increase prolactin in the serum is stress. Stress is obviously has a lot of connections to migraine. And so there's all these sort of things that are circling around. And what we were really wanting to ask was, is there a mechanistic reason why prolactin might be able to contribute to headache? And what is it? And so that really was the origin of the project.
So that's really fascinating information. And so tell me about your project. What did you do and what did you find?
Well, here we used a model that we've been working with in the lab that incorporates stress. And so we can stress, in our case, mice is what we're using. We can stress mice. It causes them to develop a number of different kinds of hypersensitivity behaviors. The animals, if you stop stressing them, will recover from all of that. And then you can probe at them for lasting sensitization with a number of things, one of which is a nitric oxide donor. And we know that those are very reliable triggers, pharmacological triggers of migraine in people. And so there's a number of interesting features to that kind of a model that are sort of reflective of migraine. And because we knew that prolactin levels are elevated in response to stress, we wanted to basically ask how much of the effects of stress are due to prolactin, and is there a difference between males and females? Because you might expect that there would be more of a prolactin influence in females than there would be in males. So the first thing really that we had to do was just confirm that when we stress mice, that prolactin is in fact elevated in the serum, and it is. It's elevated much more in females than it is in males. Females have a normally higher level of prolactin, and it goes up quite a bit in response to stress in females. Males that have a much lower level of prolactin, it also goes up in males in response to stress, but not nearly the way that it does in females. And so how do you determine whether or not prolactin is actually contributing to the responses to stress? We basically did that 2 ways. The first way that we did it was to give a pharmacological agent, the same agent that you would give to people to suppress prolactin release from the pituitary in the case of these tumors. Bromocriptine is the drug that we use. It's a D2 agonist, and that manipulates the feedback circuit that suppresses prolactin release. And so we confirm that when we give mice, males and females, bromocriptine, that it actually suppresses prolactin levels in the serum, both normally and in response to stress. And so then we just tested the behavior and said, well, how is the behavior influenced in response to bromocriptine? And in females, the treatment with the drug decreased the initial responses to stress by about half, maybe a little bit more, and also the response to the nitric oxide donor later. So there were basically two phases of this model that were influenced by prolactin, by bromocriptine treatment in females to suppress prolactin release. We did the same exact experiment in males, and it did nothing at all. So we sort of correlate that with the blood levels of prolactin in response to stress and what the drug is doing, dramatically different between the sexes, and also a dramatically different effect of bromocriptine in males compared to females. So it works in females, it doesn't work in males. We sort of wanted to confirm that with another method. Bromocriptine is not the most selective drug on earth. It's certainly a D2 agonist, but it has all kinds of other things that it does, one of which is modulate the serotonin system, which we know is a migraine relevant system. And so we used somewhat of a genetic trick, and we deleted the receptor for prolactin, but we deleted it from peripheral sensory neurons. And these are neurons that innervate the meninges, they innervate lots of tissues. These are pain sensing neurons, they're temperature sensing neurons, there are lots of different kinds of neurons. But we deleted the prolactin receptor in males and females from those neurons, and we did the exact same stress experiment again. And it looked very similar, the results looked very similar to what we saw with bromocriptine. Deleting the prolactin receptor from sensory neurons essentially attenuated the response to stress in the females, but not in the males. So both treatment with bromocriptine and deleting the receptor for prolactin from sensory neurons had a female-specific effect in this particular model.
So what does a stress response in a mouse look like? Like what kind of actions are you looking to see?
Yeah, so one of the main types of behavioral endpoints that we do in rodents, and many labs do this, it's not unique to us. How do you, sort of the larger question here is, how do you determine whether a mouse or a rat is having something like a headache? One of the ways that we do this is measuring periorbital hypersensitivity with von Frey filaments. And so this is a way to mimic the cutaneous hypersensitivity that many humans get in the headache phase of a migraine, the hypersensitivity to touch of the face and the scalp. That's something we can test for quite readily in rodents using these calibrated filaments, and you can see a change in the withdrawal threshold to those filaments. The other way that we do this is that we can actually look at the facial expressions of the mice. So there's what's called a facial grimace scale, and there's a scale for mice, there's a scale for rats. This is also something veterinarians use in their patients to assess whether the animals are having pain. So there's a grimace scale for almost every species now that veterinarians would see, but we use the mouse grimace scale. And just by looking at the facial expressions of the mice and quantifying that, you can essentially have a readout of how that animal is feeling. And it's supposed to be a selective indicator of pain, that they grimace when they're in pain. Of course, this is because we haven't yet figured out how to have a conversation with mice as you can with people. There's obviously caveats to that, but when you put multiple behavioral endpoints together, it starts to generate more confidence that we are looking at something that is a pain-like response.
Well, that's fascinating, and I will definitely be looking up the mouse grimace scale after this conversation. So how do we translate this into humans? What implications do you think this has for, migraine as a disease?
Yeah, so we still don't know in humans. I mentioned the circumstantial evidence earlier, changes in prolactin levels contributing to headaches. We don't really have a controlled study where someone purposefully manipulated prolactin levels in the context of a migraine trial. So I think, these kinds of studies would suggest that maybe it's worth doing a placebo-controlled trial in people with migraine, where the goal from the beginning is to suppress prolactin release from the pituitary, and really test in a much better way than has been done before whether or not manipulating prolactin levels around the time of a migraine attack. And of course, you'd have to figure out, when do we do this? Do we do it before? Do we do it at aura, maybe in patients with aura? When would we time it? We'd have to work all that out. But it would be nice to know in a controlled, our lights went off at the same time. It would be nice to know in a controlled trial whether or not a drug like this and a manipulation like this actually has any impact on people with migraine. Now, the caveat to this would be, I don't think that this kind of an approach would work in males. So it would have to be a female only trial. I mean, we could look in males, but I think the hypothesis and the rationale would be that this is a female specific approach, which I think is actually an interesting concept in and of itself. I don't know of any female specific therapeutics that were designed to be female specific from the beginning, outside of treatments for conditions that obviously only women or men get. So that would be somewhat of an interesting concept just on the surface, that we're going to do a trial, we're only going to do it in women because we think that this is only going to work in women. So I think it would be very interesting to know that. I think it might be a subpopulation of women. It's certainly not going to be all women. And so could there ultimately be some therapeutic benefit to modulating prolactin levels in migraine, in people with migraine? Maybe that works on its own, or maybe that works along with another therapeutic. So, combined treatment with a prolactin modulating agent and a CGRP modulating agent, maybe that creates better efficacy with the combined therapeutic approach. So I think there's still a lot of questions, but the nice thing is that there are drugs that are available for use in humans today that could be used to run a trial like this. And so we wouldn't be talking about 20 years from now, when all the safety studies have been done. We're talking about something that actually could be done relatively soon.
Well, that's fascinating, and I think that's a hallmark of great research is that it prompts additional interesting questions. And I really want to thank you for this wonderful work and for publishing in Headache. I know either you or one of the other members of your team will be presenting this work at the annual meeting in Austin. I will definitely be there, and I can't wait to hear the larger talk. So thanks again.
Thank you.